Ureter catheterism of the diseased ureter. Perhaps the most important consideration in catheterizing the diseased ureter is that any accident of catheterization, such as interference with passage of the catheter by obstruction or interference with the flow of urine by blood clot, may occur quite as readily in the normal as in the diseased. The fact that a ureter catheter is arrested or obstructed does not tell us what the obstruction is. One should closely observe the flow of urine through the catheter. If this is properly placed in a normal kidney pelvis, the urine comes slowly but regularly, drop by drop. If the patient has nervous polyuria, it flows rapidly. When properly placed in the normal ureter, the urine comes in an intermittent succession of a number of drops as described above. If improperly placed either in the pelvis or in the ureter, the regularity of the flow can be considered only under two conditions. 1. With the catheter in the kidney pelvis, there comes, first of all, a very rapid dribbling of urine, which empties out an accumulation of urine in the pelvis. Then the rapidity of the flow diminishes. But thereafter, this urine continues to show a relative dilution in comparison to that from the opposite kidney. This is hydronephrosis. With the catheter in the ureter and the bladder empty, the flow continues as though it were in the pelvis. This means dilatation of the ureter and loss of its peristaltic action. Such a diagnosis should be confirmed by pyelography. It indicates dilatation of the ureter down to the point where the eye of the catheter rests and hydronephrosis above. Inspection of the urine obtained by ureter catheter is often most misleading. The urine may be clouded by epithelial cells. It may be bloody, though the ureter and kidney are entirely normal. The urine should therefore always be examined by microscope. The collection of urine should usually be delayed until the bladder is emptied, for the chronically diseased ureter may permit reflux of fluid from the bladder, which returns through the catheter in a continuous stream until the bladder is empty.